Hi, I am Dr. Amber Belt, aka Dr. Belt Sander, and I am here today to talk to you about platelet-rich plasma treatments. I'm going to keep this video as short as I can, and I'm going to try to keep it as relatable as I can. And I am going to substitute the phrase platelet-rich plasma with PRP because it's just a lot shorter and easier to say. First of all, I love PRP. I love doing these treatments. PRP uses your body's own platelets to promote your body's natural healing response when it comes to your joints, your ligaments, and your tendons. Yes, it is an injection therapy, and if you want to know more about the nitty-gritty details of it, comment or get on my email list, or both, because I can provide you with some more information. And so platelets are naturally found in our blood. Due to the way that we process the PRP, it's going to concentrate the amount of platelets into a little bit of plasma. And generally, it works like this. I take out someone's blood, I spin it down in the centrifuge, and then the blood separates into a layer of plasma, a really thin layer of platelets, and then a pretty hefty layer of red blood cells. And what I do is I take off the majority of the plasma and then take off the rest of the plasma with the platelets, and I discard the rest. So this is essentially what the PRP solution looks like after it's processed. This is actually just oil and red wine vinegar. I didn't take anyone's blood and steal it today, but I would take off, this would be the plasma. I'll take off most of this. I'll leave a little bit of plasma. There's going to be a little layer of platelets in there that I'll take off too. And then all of this part down here will just go in our biohazard. All right, so that's kind of procedurally how it works. Platelets, of course, we know as factors that we need in our body for our blood to clot when we when we cut ourselves. But the platelets are really good multitaskers, and part of that multitasking is being able to release a lot of growth factors to really kick off that inflammatory process and get healing started. So without platelets, we're kind of sunk as far as healing goes. So when we draw off all of this plasma and we take a lot of platelets out with a little bit of plasma, we have a lot of growth factor potential there, and we're relying on those growth factors in a really concentrated area to promote an accelerated healing response. And that's what we see with PRP, is an accelerated healing response, which is awesome. PRP works really well for a lot of conditions. It works for acute tendonitis. It works for chronic tendonitis. So whether you just messed up your elbow or your elbow has been painful for 5 years, PRP is going to help with both of those conditions. It's going to help with osteoarthritis. So your knee, your hip, your ankle, your shoulder, your hand, all of those areas are going to respond well. It works great for low back pain. It works great for tears of the labrum in the hip and the shoulder. It works really well for meniscal tears in the knee. It works well for plantar fasciitis. It works for acute muscle injuries, like I said, elbow pain, chronic ankle sprains, temporomandibular joint issues. It works well for those too. So if you follow me too, you know that I am all about having your health foundations in order before you get a regenerative injection, because you're going to heal better and you're going to need less treatments. So your tissue will heal much more quickly if you're exercising, if you're eating well, and if you have your hormones balanced and all of those foundations are in place. So that's it in a nutshell about PRP, and I hope you learned something. I hope you're inspired maybe to learn more. Hop on my email list if you want more information from me. It's over in my bio, and I won't spam you. I send out about 1 email a week, and I try to make it full of useful information. All right, thanks.